Adenorythm uses, mechanism of action, and precautions. Adenorythm is a medication containing the active ingredient adenosine. It is available as an intravenous solution. Each 2 ml vial contains 6 mg of adenosine. What is Adenorythm? Adenorythm is a medication containing the active ingredient adenosine. It is available as an intravenous solution. Each 2 ml vial contains 6 mg of adenosine. Uses of Adenorythm. Adenorythm is indicated for the following. 1. Diagnosis and treatment of tachycardia. Diagnosis of acute tachycardia. Adenosine is used to diagnose various forms of tachycardia, particularly paroxysmal supraventricular tachycardia. Its rapid action helps pinpoint the location of the abnormal pacemaker and rule out other causes of rapid heart rate. 1. Diagnosis and treatment of tachycardia. Pharmacological stress testing. Adenosine may be used in pharmacological stress testing to evaluate the heart's function, particularly blood flow through the coronary arteries. 1. Diagnosis and treatment of tachycardia. Treatment of paroxysmal supraventricular tachycardia. Adenosine acts quickly to terminate these episodes by inhibiting the conduction of electrical impulses through accessory pathways in the heart. 2. Assisting in coronary angiography. Adenosine acts as a coronary vasodilator, increasing blood flow through the coronary arteries. It is used in conjunction with coronary angiography or echocardiography to detect any defects in blood flow or localized abnormalities in contraction caused by coronary artery disease. 3. Mechanism of action. Adenosine belongs to the purine receptor agonist class and works by acting on the adenosine A1 receptor in the sinoatrial SA node and atrioventricular AV node. Effect on SA node. Adenosine slows down the firing rate of the SA node, resulting in a slower heart rate. 3. Mechanism of action. Effect on AV node. Adenosine decreases the conduction of electrical impulses through the AV node, helping to block the propagation of tachycardia. 4. Precautions. Use only as prescribed by a physician. Adenosine is a prescription medication that should be used under the supervision of a qualified healthcare professional. Intravenous administration only. Adenosine is administered intravenously only. It should not be given orally or intramuscularly. 4. Precautions. Caution in certain patients. Patients with severe heart failure. Patients with asthma. Patients with a history of allergy to adenosine or any other components of the medication. Patients with severe heart failure. Patients with asthma. 4. Precautions. Patients with a history of allergy to adenosine or any other components of the medication. Side effects. Adenosine can cause side effects such as flushing, dizziness, nausea, shortness of breath, chest pain, and bradycardia. In case of any side effects, immediately notify your doctor. 4. Precautions. Storage. Store adenosine at room temperature, away from direct sunlight. Patients with severe heart failure. Patients with asthma. Patients with a history of allergy to adenosine or any other components of the medication. 5. Drug interactions. Adenosine can interact with other medications, so inform your doctor about all medications you are taking, including prescription drugs, over-the-counter medications, vitamins, and herbs. Important notes. This information is for general knowledge and should not be considered as medical advice. Always consult your doctor or pharmacist before using any medication. Read the patient information leaflet carefully before using adenosine. Additional information. Adenosine has a short duration of action, lasting only a few seconds. It is not used to treat chronic tachycardia. Conclusion. Adenorythm is a medication that acts quickly in the diagnosis and treatment of tachycardia. However, it can cause side effects, so it should be used only as prescribed by your doctor.